The following is a presentation of the Healthcare Facilities Network. I know you've done a lot of research into salaries. You've produced a lot of information. Did this particular survey go into anything relative to salary?
It didn't break down salaries by level. Now, it did provide a holistic view to say this is how much you should be spending on your
Okay.
your your EVS department should be expecting this number as far as your total compensation. So it did provide that. It didn't say, well, if you're a manager, you should be paid this, and if you're a technician, it doesn't break it out to that level. It also shows, specific to that, it does show a breakout in the facility engineering program. It'll show a breakout by roles. So it'll show, of the 50 FTEs that I'm saying I should have, what percentage of those should be mechanics, what should be plumbers or carpenters or HVAC techs. It does break it down by that level of detail.
Oh, how did you determine that?
Again, it's through surveys. So the hundreds of hospitals, we said, well, what percent of your staff are carpenters, or what percent of your staff are HVAC? So when we average those things together, that's what we found is we could accurately and reliably predict, okay, this is kind of the breakout traditionally. And again, it's a benchmark. So yeah, you might have some variation within your group, but it should be, if you're seeing this huge difference, like I based on the size of my hospital, I'm showing I should have 2 carpenters and I have 15.
Yeah.
Then you start saying, okay, what's going on here? If you have, if the report says you should have 2 and you have 1, okay, that's
Right.
nothing to be worried about.
Now, I have to keep reminding myself that you did a benchmarking survey and you weren't doing a trending survey, but you've done a lot of research and I'm sure you can't turn your mind off. Did you find anything though when you were looking at staffing, size of staffing, anything that kind of, a light in your head and said, oh, that's really interesting, just based on what you know about the industry?
What I found interesting, I guess I will say, was something new we did was understanding work portion of facility engineering work group by shift, for example. That's never been looked at. So to say, well, okay, previous reports said I needed 20 facility engineers. Now we can actually show, oh, well, this percent should be at first shift, this percent at second shift, this percent at third shift. So there's just some, it wasn't surprising, but I just thought this is really helpful, I think, for facility managers to say there's some real value in this information. So that was one area I was kind of proud of, to say I think we've really addressed some gaps in those previous reports. The one thing I'll back up to one of your early questions about this compliance issue. So what was surprising or interesting? That was always a topic that I've heard at various ASHI conferences, and as I've met with facility leaders around the country, is we're really getting a lot of pressure for a lot of budget pressures, and when it comes to compliance, if a CFO says, hey, I need you to cut your budget by 10%, you can't go cut your compliance budget by 10%. It is what you can't do that. And so what I think folks were looking for is to say, well, if you tell me to cut my budget by 10%, I can't cut my compliance budget. So the other areas of my budget is going to be cut by 15% because I'm compensating. And so we were able to determine, I think it was about 25% of your maintenance budget is compliance. So that's helpful now because, again, I had no idea. I really had no idea how that was going to play out, what it was going to look like. But yeah, 25% of your budget's compliance. So now, again, you have some real data that you can go back to potentially to your budget group and say, look, I know you want to cut X, Y, and Z, but we can't cut compliance. So really you're asking probably more than I can handle, right? So it's just that's helpful, I think, for any facility leaders to have that empowered with that information.
It is, yeah. And so they actually, I found that online, where portion of maintenance expense by category, reactive was 31%, preventive, you had 41, and then compliance was, I'm going to ding you by 1%, 26%.
Yeah.
So you were close. You were close. Yeah, it would be interesting if, and you've got it in this one, so now you can measure it going forward. But historically, I wonder what that number had been for compliance. It would be interesting to compare over the years, as there's such a focus on compliance and regulatory and risk.
Mhm.
I have to assume that number is rising.
Yeah, again, so now that we're tracking that, I'm assuming, I hope that further iterations will continue to track that so we can again look at those trends and say, well, actually, we're seeing, the portion of our maintenance costs is growing in compliance, for example.
Right, right.
You also mentioned reactive, right? I think we all pride ourselves on being very preventative, but the reality is there's still a huge portion of our maintenance costs that are reactive, which so that's another trend I hope we see dropping, to show, hey, we're becoming less reactive, we're being more predictive. So that would be a goal I'd like to see.
Um, Relative to the compliance portion of it, are you able to, or were you able to break it down again, benchmarking survey, but how much is in-house versus out-house, or out-of-house spending for compliance?
We show what portion of your overall budget, not specific to
Okay.
compliance, but just specific, like what portion is going towards contracted expense. We also show what portion of our workforce is outsourced versus in-house. So you can say, oh, okay,
Oh,
I can kind of understand that mix. So we have we have management to staff mix, to understand, hey, what percentage of my program should be management versus staff, and we also look at that as a portion of our workforce that are contracted, and whether that's biomedical or facility engineering or VS, we show that information.
getting back to the, you were talking about the shifts and the three different shifts. So were you able to break it down that, first shift is more on the reactive, second shift predict kind of the PMs and the work order management? Were you able to find anything like how people compose those shifts and what they do on those different shifts?
No, sorry. Yeah, we didn't dig into that detail to say,
I'm
well,
sorry.
what's actually happening in those. It's a
Yeah.
great question, but this is what's helpful, Pete. Is what's fun about this is people get this report and they say, did I, did you get this information? I said, well, no, I didn't. I take a note, and the next iteration we try to dig into that, because this is the beauty of this is we're trying to help the industry move forward, and we're trying to
Right.
help people answer questions. So I love these type of questions, that I get from people to say, hey, did you dig into this? And sometimes I say, no, I didn't, but we'll try to get that, next
Yeah.
round for sure.
Well, I got to imagine too, from like a process, like once you define what you want to do, again, you're not working in a vacuum and you're not new to the industry. You must see these different tangents, but you must just stay focused on that mission for this, right? Because you can't go all over the place because you'd never complete anything.
Yeah, and there's a fine line with benchmarking, because we want it to be easy to reliable but easy
Yeah.
to use, and we don't want this 50-page report that gets confusing. So again, we're always trying to find that balance between good information that's helpful without getting too much, the academic side of things that can, like, here's so much information that's not
Right.
useful. Like, we
Right.
really try to shy away from that. At least that's my goal. And I think we're getting better and better at that. And again, besides my own background, we had an advisory team of folks, and they're recognized in the report as well. That I reached out and said, hey, what's something you'd like to know? Like, what's not been captured before? And so we got a lot of that feedback before we developed the survey to make sure we were trying to capture the right information.
From a both a positive surprise and maybe a concerning type surprise, was there a positive benchmark that you found and one that was kind of a concerning benchmark?
Um, I'm looking at the report right now to see if I can. So the the area that I was most excited about to learn was really, this issue of deferred maintenance or aging infrastructure,
Okay.
because it's such a big topic
Yeah.
that nobody's really ever benchmarked that before. So yeah, it was concerning to me when I saw that, there was a high level of deferred maintenance. It is costing us 3 to 4 times the amount that it probably should if we just had the money available. Um, but I'm concerned about that, and also most of the time there's an unplanned shutdown. It's because it was in deferred maintenance. It wasn't,
Hmm.
there's all these shutdowns that are happening is because we're not being proactive and we're putting them in deferred maintenance. So not only is it costing us more, but it's also most of the time it's impacting revenue as well.
Yeah.
So we don't
So
necessarily go ahead.
were you, I think that's where you were just talking. I was gonna say, were you able to quantify that?
Yeah, so we actually show, well, we weren't able to say, well, it's this dollar amount, but we were able to say
Yeah,
most of the time a
sure.
shutdown occurs, it's impacting revenue. So not only does it cost us 3 or 4 times more, but on top of that, we're losing revenue.
Yeah.
So even though this is kind of it's a negative in that we're showing, wow, deferred maintenance is really costing us a lot of money. There's a positive spin to that to say, well, now we actually have data that can support us in developing a business case instead of just kind of saying, hey, we're all really nervous that something might shut down, and we
Yeah.
really, this boiler is really on its last leg, and it's all, historically it's all been kind of quantitative or qualitative, and we don't feel good about it,
Yeah.
but now we have real dollars and cents that facilities leaders can use to now compete, right? Because there's limited capital, and so we're competing against a lot of times revenue generating proposals to say, hey, if I buy this new MRI, we're going to see this ROI. Now we can actually compete on level ground with those type of capital requests because of the data that we now have.
Yeah. Yeah. So this is, excuse me, this is information that a director can take right up to the CFO and tie it directly there to a cause.
I think that's the beauty of it. Yeah. So it's information that can now be used to develop capital requests that can compete fairly with an ROI attached to it to other assets.
I don't know if you mentioned this, and I don't know if it was part of it, but did you do anything relative to? Did you do anything? You didn't do enough, Steve. Do more next time. I don't mean it that way at all, but relative, did you infrastructure, aging infrastructure, renewal, anything from like a capital planning perspective included in the survey?
Well, absolutely. So when you talk about capital planning, saying, well, how much, based on our size, on our whatever metric you want to pick, right? Beds, replacement value, based on whatever metric, there's a benchmark now saying, well, this is how much you should be spending every year in
Okay.
capital renewal, right? It's not operating expense.
Yeah.
It's just annual renewal. So I should be, based on the hospital, I should be spending X number of dollars on uh on capital renewal to make sure I'm not falling into a state of disrepair. So yeah, so facility users can use that now to say, hey, capital planning, I know how much, at least based on a benchmark, I should be spending every year. So it's really helpful in that sort of area.
I know it wasn't part of your survey, but whether it be anecdotally, did you find that our facilities folks, so I guess I'm concentrating more on the facility, are they getting pulled in different directions than in the past? Maybe more kind of like on a real estate component or on a sustainability. We all know that there's so many priorities and the priorities are increasing. So I guess what I'm asking is, are you able to determine, are they doing more kind of outside of their core functions?
Yeah, this survey didn't necessarily touch on that, but just anecdotally, and I would say the industry is maturing.
Hmm.
I will say the expectation of what a healthcare facility leader does, it's changing, right? It's becoming the expectation is it's becoming more of a strategic partner for the business as a whole. Now, whether we're adequately responding to that through our development of our own skills and delivery of those things, that's to be determined. I think that's some of our biggest problem is the industry is really demanding this, right? They're demanding folks that understand sustainability, that understand, operating, processes, that understand real estate strategy.
Yeah.
Whether we actually are developing people that can do that, I think that's part of the issue we're having within workforce development is we can't find a lot of kind of more senior level people that have that robust background, just because historically how we've kind of developed and trained our folks to be so dedicated to the kind of the operation of the hospital that we really need to start preaching that. Now, that's not to say that that's not very important, but that's my feel on that, I guess, that
Sure.
topic.
And you've done research into that as well.
A little bit, yeah.
Yeah, a little bit. I want to ask two more questions, be respectful of time here. I guess relative to FTEs, are you able to tell is FTEs, and you're not looking at it as an issue, but any concerning trends around FTEs, I guess, are people being more outsourced? Are people not being replaced? Is FTE count concerning? Or it's not concerning?
Yeah, and that's something, again, this is the first time we've looked at contractors as a percent of workforce. So that's an answer that I hope we could have maybe next time we do this report, is to say, what trend are we seeing? Is outsourcing becoming more prevalent?
Yeah.
I don't know that yet. I mean, we definitely have kind of a snapshot of the current state. I don't know if that's good or bad. But again, if you have the report, you could look at that and say, well, that's interesting. My staff is different, or it's the same. I don't know, but that's something hopefully we can start tracking, is to say, how's that affecting what we're doing? So not only and I can't remember actually off the top of my head, but I think we have a portion of outsourcing as a percent of management, not just technical staff. So of my management team, what percentage of that is outsourcing? Because that, I believe, that's really the potential area where outsourcing is becoming more prevalent, is on the management side of the equation.
So would that be outsourced to like a Crofel or Sodexo or CBRE, any one of those third party
Typically, yeah, that's really what we're seeing, is it's more of those larger facility services groups that are potentially making inroads. We don't know, right? Because we just have that data now, so we'll see how that goes over the years.
Interesting. You must love this stuff. Do you enjoy this?
Yeah, I do. I love it because I think one reason I got into this area was because I saw so much opportunity to help move the industry forward, because there was so much missing research.
Yeah.
And again, it all started when I would go to these ASHI conferences year after year after year, and they'd say, we're all getting old, look around, look at all the gray hairs.
Right.
And I'd sit there thinking, oh, great, who has the answer? And then we moved on to talking about, boilers and chillers.
Yeah.
I thought, gosh, we know this is a huge problem. Why isn't anybody, and I think things were being done, right? Oh, let's do internships, or let's do this. But nobody actually looked at the data to say what's really happening and what is the data showing that can really help. And so not whether it's workforce planning or whether it's aging infrastructure, whatever topic it is, my goal and my passion is developing research that can actually be applied in the industry to help healthcare organizations be successful.
And what is usually a time length between, like, you've talked about a next survey. How long do you usually have to give that before you survey again to be able to assess kind of trends and to have the info still be valuable? Is there a length, or is it whenever it happens?
Yeah, I don't know if I have the answer to that. My feel is at least I wouldn't say more. Every year would be too much. I think maybe every other year every 2 to 3 years is probably the sweet spot. You could argue something like COVID, for example, like pre-COVID, post-COVID, like that would be in there. Like, okay, something dramatic has happened, we should be analyzing. So that would be an example where you might try to make them a little closer together. But yeah, historically, this information has not been kind of routinely updated. So IFMA has really made a commitment to do that to help the industry. So I'm excited, and we'll hopefully keep doing this every couple of years.
Yeah, if you think about it, I mean, 2014 was the ice ages now. You throw COVID in, it's just Everything's
Yeah.
flipped. Everything's
Yeah,
flipped.
yeah. I mean, costs have gone crazy.
Yeah.
And again, this is what we're trying to say is if we're still looking at 2014 as our basis for how we're generating our budget, we're really hampering, hurting ourselves. So this information can be really helpful.
I think even just taking your FTE data and breaking it apart, not by square footage, but by that number of different ways, that's helpful in and of itself.
Yeah,
Because that's always the question. Am I appropriately staffed? Well, what
yeah.
are you using as a metric? Is there anything Steve and Dr. Stephen Call, assistant professor, Washington State University, we're talking about the North American Medical Center Facility Support Services benchmarking report that you've done for IFMA, and I'll put a link to it in the video. Is there anything I should have asked you about, or anything in the report that you'd want to get out before kind of as we leave? Any interesting research or anything I should have asked you that I didn't?
No, I think you've asked some great questions. The only thing kind of what's interesting about this report, what do we find interesting? I will say it may be surprising, but when we looked at utility expenses, for example, when we looked at utility expenses across the nation, we actually didn't find a statistically significant difference on location. So whether you have a hospital in Michigan or a hospital in California, if you're looking at costs, there's no significant difference between a hospital in different parts of the country. So that's really surprising to folks. It's like, what do you mean? How can, and I think it has to do with, just this is my own guess, but the data shows that there's no significant difference. Yeah, there is some there's some difference. There's, 5 or 6 cents per gross, whatever. There's some difference. But for example, California, utility consumption is probably lower, but costs might be higher. And in Michigan, costs are lower, consumption's higher. So it kind of evens out, I think. I think that's the explanation. So historically, we've always said, okay, well, I need to know, I need to find, okay, I'm in Michigan and now I'm in this region and this is my cost. We found that, you can just use a simple predictor number and poof, you've got your data regardless of where. Now, I did go ahead and include that in the report because I think there was a lot of like, wow, we've never done that before. So I still allow that. You can search by your region and your state and find your cost. But I found that really, really interesting, that's how the kind of the data played out.
Yeah, no, I would agree. I mean, because you always look where I am, the Northeast, it's more expensive. You pay more. So that's an interesting finding.
Yeah, it was. And so what that does, it just makes it easier.
Yeah.
Just makes it easier. And again, I guess one last thing I want to say is this is, as we mentioned, this is a benchmarking tool. Some folks want benchmarks to tell them exactly what, this is exactly what my FTE count should be. This is exactly what I should be spending on utilities. And benchmarking is just simply an estimate based off of a number of factors. It tries to say, am I in the ballpark? Am I 10 to 15% within my peers? If I am, I should be happy with that. If we really are trying to figure out what should I really be spending, that's a process that should be done through the CMMS and understanding what my actual costs are. But benchmarking is beautiful because it's reliable, but it's very easy. So it's a really good place to start.
Yeah. And even I could use it going through those pages, and I'm sure this is even easier to use. So, Steve, thank you for your time today. I appreciate it.
You're welcome. It's always a pleasure.
My pleasure too. So go and buy the IFMA survey. I'm going to link to it. So if you want to get, not survey, benchmark. You've said benchmark how many times, and I'm calling it a survey. Dr. Stephen Call, thank you for your time. Peter Martin for the Healthcare Facilities Network. As always, thank you for tuning in, and we will be back in the future. Have a great day. Thank you for watching this episode of the Healthcare Facilities Network.